Hello everyone, this is Dr. Ananya. Welcome to my channel. In today's video, I'll be talking about acid-fast Bacillus test, that is AFB. Before beginning the video, I would like you to subscribe to my channel if you haven't, so that I can share all the useful and valuable information with you. So first of all, let us know what is AFB. AFB means acid-fast bacillus. AFB is a type of bacteria that causes TB, known as tuberculosis. It also causes certain type of infections. TB is a serious bacterial infection that mainly affects lungs. It can also cause infections in other parts of bodies such as brain, spine, and kidneys. TB is spread from person to person through sneezing or coughing. TBs can be of two types: latent TB and active TB. If you have latent TB, it means there is TB bacteria in your body, but there are no signs or symptoms. Also, having latent TB means you cannot spread it. If you have active TB, it means you will show signs and symptoms. Also, you can spread the disease. AFB tests are usually ordered for people who show some signs and symptoms of TB. This test usually looks for bacteria in your sputum. Now, what is a sputum? Sputum is a thick liquid that is coughed up from the lungs. It is very different from saliva and spit. Now, talking about AFB test, there are two types of it. The one is AFB smear test and other is AFB culture test. In smear test, a sample of sputum is taken and seen in a glass slide. The results are pretty quick. It takes 1 or 2 days to get the results. AFB smear test can tell about the likelihood of infection, but not the definite diagnosis. The other one is AFB culture test. For AFB culture test, a sample of sputum is taken and then it is sent for culture. This test gives you the definite diagnosis of TB, but it takes at least 4 to 8 weeks to get the definite diagnosis. Now, let us know what are these tests used for. Most of the times, AFB tests are used for diagnosing tuberculosis. But sometimes, apart from using it for tuberculosis, we may use it for other diseases. Other diseases may include leprosy. Leprosy is a rare and easy treatable disease. In leprosy, the skin becomes flaky and red, and there is a loss of feeling. AFB can also lead to other diseases that may weaken your immune system. AFB is also used for people who have already been diagnosed for TB. Now, this test is used for a different purpose. We do this test to see if the treatment is working or not. Now, let us know why you may need an AFB test. You may need an AFB test if you show active symptoms of TB, which include fatigue, continuous coughing for more than 3 weeks, coughing with blood, chest pain, night sweats, and unexplained weight loss. Active TB can also show symptoms in other parts of the body besides the lungs. Symptoms depend on which part of the body is affected. You may need testing if you show symptoms of back pain, headache, joint pain, weight loss, and blood in your urine. Sometimes you may also need an AFB test if you are in higher risk of getting infected. It means either you are located in an area with a higher number of cases of TB or you have been in contact with a person who has an active infection. Now, what happens during an AFB test? During an AFB test, you will be required to give a sample of your sputum. Sputum is used for both the tests. Either it is AFB smear test or it is AFB culture test. For collecting the sputum, you will be given a sterile container in which you need to cough continuously for 2 to 3 days. This makes sure you have enough bacteria for test. Sometimes, if you have difficulty in coughing or collecting your sputum, you can tell your healthcare provider. And then you will be asked to breathe in a sterile saline, which will help you cough more. Also, if none of the methods work, you may need a bronchoscopy. During a bronchoscopy, a tube is inserted into the airways from where the sample is collected. Don't worry, during this procedure, you will be given a medicine in which you will not feel the pain. Now, how do you prepare for the test? For this test, you need not prepare anything. Are there any risks to this test? There is no risk in providing the sputum sample in the container. If you have bronchoscopy, then you may have a sore throat, which will be healed in 2 to 3 days. Now, what do the results mean? For AFB test, the result is either negative or positive. If your AFB smear test is negative, it means there is no infection in your body. If the AFB smear test is positive, it means there is an infection in your body. But smear test is not enough to confirm the diagnosis. So, if your smear test is positive, it means you might also need AFB culture test, which will take some 6 to 8 weeks. Now, is there anything else which you might need to know about TB or AFB test? Okay, so here it is. A lot of people take TB very carelessly. But if not treated, TB can be very serious and deadly. TB can be cured if you take your medicines and antibiotics on time and in a regular method provided by your doctor. But treating TB takes much longer than treating any other diseases caused by infection or caused by bacterial infection. For TB, you may need to take antibiotics from 6 months to 9 months. But make sure you do everything under medical supervision. And in case if you stop using antibiotics earlier, then the infection might come back. So it is very important for you to notice your symptoms carefully. A quick reminder. It is necessary for you to get tested from a reliable and reputed lab. A link to a reliable and reputed lab will be provided to you in the description below. That's all for today's video.